Extract from the conversation avec le sieur Blondeau. The American Indians' medicine. The savages have a natural medicine and they have doctors. They also live as long as we do. And they have fewer illnesses. They cure almost all of them except for smallpox, which still wreaks havoc amongst them. It's a disease that was unknown to them before they started dealing with us. They have a good knowledge of syphilis and of the other venereal diseases. They treat them with infusions made up of a few simples that they are the only ones to know about, except for a few voyageurs of the Pays-d'en-Haut. I believe, however, that those medicines are more palliative than curative in character. Their main guidelines for the cure of all sicknesses or ailments are a severe diet, sudation of the patient, use of a vomitic and purgative substances, and recourse to rectal injections. They have no knowledge of the existence of cassia, manna, senna, rhubarb, or quinquina, but they are capable of obtaining the very same results we get from these drugs by making infusions of the plants they are familiar with. They have specific treatments for curing scrofulous tumours or scrofula. They rarely make us of bloodletting, and they know nothing of the foot version of that treatment. When they do, they operate with a sharp-pointed knife and a flintstone. Their sick are subjected to a much stricter diet than ours. They serve them a very clear soup made of any kind of meat, but preferably of fish, an approach which Mr Hequet would have approved of. In the making of these soups for their patients, they only exclude the following. From amongst the lean meats, only eel, trout, and sturgeon. Amongst the fat meats, only turkey, doe, bear, pig, and beaver. Judging by their success, they are as good doctors as our own. They know very little about chemical remedies. They are only great botanists and have a perfect knowledge of the simple. I don't believe that the savages' doctors are as skillful in the field of surgery. They reset dislocated bones. They restore fractures by the use of bandages, but not being as adept as we, their patients are sometimes left crippled for life. They are not versed in the terrible but unfortunately necessary art of amputations. They cure wounds that are not considerable by sudation. They also serve infusions for their wounded. They also have alleviating decoctions for chest pains. They never use milk. Their sagamité, which is made with corn, makes for a light and refreshing food. They also make us an infusion that they consider to be a very good solvent for stone, calculus, or gravel.